Hello.
Hello.
Good morning, sir. Myself, Dr. Chandrasekhar, founder and managing director of MSR Education Consultancy. Hello, it's pleasure meeting you, sir. Today we are with Professor Archil, sir, in Kenwalker International University, rector of Kenwalker International University, head of International Relations and program director of Emory Medical University, USA. Hello, sir.
Hello.
So, what about?
It's very nice to meet you.
Nice to meet you, sir. What about Kenwalker International University and which medical program Kenwalker International University is offering to the students?
Well, first of all, welcome to Georgia and welcome to Kenwalker International University. My name is, as you mentioned, Archil Vundilashvili. I'm a director of educational program at the Emory University School of Medicine, and I am head of this collaboration between Emory University and Kenwalker International University. We started this university in collaboration with our international partners, and we are very proud of this university as it offers to these students globally highly competitive medical education, very affordably and within the comfort of this beautiful country of Georgia. Kenwalker International University offers medical education which is based on Western American MD curriculum. Actually, we took and modified Emory University's medical school curriculum to be acceptable for international standards, more European standards, Indian standards, English standards, and to make sure that the diploma would work in every country that students would want to work in when they graduate medical university. Some of the unique opportunities that Kenwalker International University offers to its students are this very modern, innovative curriculum, integrated curriculum that is based on the USMLE, United States licensure examination requirements. So every student has an opportunity to prepare for USMLE exams in the university, and also every student who does well in the program and who follows curriculum and studies well, every student has an opportunity also to go to United States for two different programs. Actually, one is for the summer program early on, like the first group of the students of the Kenwalker International University will go in summer 2024 to visit Emory University and actually first-hand see how American educational system works, how American hospital system works. This will be mostly observational visit so that students understand what is American medical education, why is this program is American curriculum, and what we want them to learn and how we want them to educate them in the medical specialty. And the second opportunity, which is even more important opportunity, is when after passing first licensure exam, students can actually come to Emory University and do clinical rotation. That's when actually they get opportunity to do clinical education at Emory University clinics. So this actually prepares them already for the application process of the residency program, postgraduate medical education in US. These are some of the very unique features that Kenwalker International University and the partnership with us at Emory University offers in Georgia. It's a great opportunity for any student, regardless of what country they are coming from and regardless of where they want to practice, because the goal is to make sure that the graduates of the Kenwalker International University are competitive anywhere they want to practice.
It's great to hear from you about your university, sir. Sir,
it's very nice to
students can get any letter of recommendations from the physicians of Emory Medical University while they are doing the clinical rotations in the summer camps?
Yes. Students get the recommendation letters from their attending physicians when they are doing recommendation when they are doing clinical rotations at Emory University. So that's a usual route of getting the recommendation letters, because the recommenders need to know the students to recommend them. So that's a very great opportunity, because students will work with those attending physicians who need to recommend them for the postgraduate education.
Here the faculty in our universities will support and guide the students in preparation of USLME Step 1 and Step 2.
Well, students are very familiar with many of the Emory University faculty because Emory faculty regularly visits, we regularly visit Kenwalker International University and meet the students, have lectures with them, consult with them, and as they get into more advanced levels of the medical education at Kenwalker International University, these meetings actually will become more frequent, because one of the goals is actually to make sure that to coach them for, like, to do a career coaching, so that they know what to do and how to do after graduating medical school, whether it includes what to expect during the interviews, whether it means what to expect during the examination, or what are the best fit for those who want to apply to postgraduate medical education. We are the best fit for them would be. So all the professional advising, all the career coaching happens here in-house at Kenwalker University, and together with our Georgian colleagues here at Kenwalker University, our faculty from Emory University is deeply involved to make sure, to assure the success of our graduates here.
It's great, sir. What about the clinics and the hospitals affiliated to the Kenwalker International University? How the students are getting the clinical knowledge and clinical rotations in those hospitals here in Georgia?
Kenwalker International University has one of the largest network of the clinical bases in Georgia. So if you look out of the window, you will see one of the main hospitals in Tbilisi, which is a university hospital. We have a trilateral affiliation with Tbilisi State Medical University. We also have partnership programs, so we work very close with them. So there are many large clinics that, including the cardiology clinic, pediatric clinic, and two major multidisciplinary, multi-profile clinics in Georgia, and also, of course, rehabilitation clinic that we are located in and adjacent to.
It's great to hear that Kenwalker is having this much partner universities and the vast clinical knowledge you are providing to the students. By the way, the next question is, how is there any system to guide the students in the pattern of next one and next qualifying examinations parallel to the USLME?
Well, every student gets an opportunity to have an advising here. So our faculty is motivated and dedicated to the student success. So we encourage every student to make sure that they communicate with our faculty members, and they communicate with their student advisors, with their basic science faculty, to make sure that they don't miss anything in the beginner levels, and to make sure that their promotion to the advanced level studies is smooth and without any obstacles, so that they don't have any problems towards the later years when they have to work very hard for their examinations, work very hard to get an opportunity to go for exchange programs, and so we are working hard to assure student success here in that direction.
Okay. In India, parents think that being into a medical school, there will be ragging in India. So here in Georgia and Kenwalker University, how you make the steps for the safety and safety for the students to prevent the ragging acts and everything?
What is ragging?
Ragging is nothing but a senior student is insulting the juniors.
Well, I just recently had a talk with one of the more senior students in the university. We actually are trying to create a family atmosphere here, where, students don't feel anything but being part of something whole, one whole. Yes. And we make sure that, every student understand that they have same meaning for the university, for us, and we are trying to promote the idea, that friendship and the feeling of belonging to this family of Kenwalker International University is what matters, and how we will differentiate ourselves in addition to being like different kind of curriculum, different kind of educational model, our differentiation with this sense of belonging, sense of friendship and unity is going to be our biggest winning card. So looking at our history now at Kenwalker International University, I think we are successful. So far, we already have a student body of more than 300 students. That's not small. And, you know, looking at the students' behavior, we've had some sports competition. They are very friendly. They cheer for each other. They support each other, and we really appreciate that. Besides that, as I said, you know, we talk to students, and they seem to understand what we mean by that. And saying that, can something happen? Maybe. We hope not. But we try to be on top of everything, and we try to be aware of the situation, and if there is a risk of something, to make sure we prevent it in the beginning. And all of that is happening with the support of the students, because without support of the students, we cannot do anything. But what our role is to make sure that students understand that we are on their side, we are not superiors to them. We are not trying to look at them from the top, and we want to be with them friendly, because at the end of the day, what matters the most is for them to be successful, because that's the only way we can be successful. And for that, we need to make sure that we work together. So if we work together, if we believe that there's this unity, I think there's a lesser risk that something like that is going to happen in the university, and one student is going to try to behave inappropriately towards the other.
Yes,
So,
coming to the pre and paraclinical subjects, sir, along with the theory, students know practical knowledge very well. So in the fields of anatomy, biochemistry, physiology, and microbiology, pathology. So how is the labs in your university and the infrastructure regarding that, sir?
so labs are practiced in the university, and they are being developed on a daily basis. We are still even now we are expecting a shipment of some additional supplies. I know that the faculty is conducting special lab days where they practice with the students various activities. But in addition to that, one of the big differences of our educational model here at Kenwalker International University is actually early beginning of the clinical education, because that is the most important part of the medical education. Without sufficient clinical exposure, you cannot become a good, strong physician. So early exposure to the clinics is what we actually really pride ourselves with, because we have introduced the subjects in in medical education in this country that had not been practiced in Georgia before. Maybe now some other medical schools have taken example, which would be great, of course. But like pretty much from the very first day students set their foot, along with those basic subjects, we make sure that students get used to the clinical behavior, bedside manners, history taking, use of instruments. And as you may see, we have classrooms that are organized with the exam tables and the clinical exam equipment, and they are starting with the classmates. They actually can practice on the standardized patients, which we actually have a special group of the actors that have been trained to be the patients, and in most of the cases, actually, even the experienced physician cannot say whether or not this is a patient or someone playing to be a patient. So before the student goes to actual hospital, actually our students are already well trained on how to behave in the hospital. So that's why every time our student sets foot in the hospital, they are familiar with the environment. They know what to do, how to behave, how to relate and talk to the patient or the guardians or the physician and and nurse and other personnel. So those are the things. So to every practical subject we pay a lot of attention, and we believe that's how you make the good physicians.
There is a myth in India. In Georgia, only students are allowed to practice on the medical simulators. Is there students are allowed to touch the patients while in their clinical rotations in Georgia?
Without working with the patient, you cannot become a physician. So students are practicing the same way as it is acceptable by international standards of the medical education. So there is a time for everything. As I said, from the very first day we start training them in the classroom, then we will move them to the simulation, and then we will move them to the clinics. So of course, instead of making medical manipulation directly on a patient, we will teach the students on a simulator first. But same way, actually, during the educational process, as the students learn the clinical subjects in the hospitals and practice medicine with the real patients, at the same time they still train with the simulator, so that actually this continuum assures the quality of the training, so there's a continuum in the practice. But I don't know what is said about other places, but here everything has its time, and every student practices, gets a clinical education and exposure to the clinic and the patients the way it is set by the international medical educational standards.
According to the new NMC guidelines, our FMG foreign medical graduate examination is replaced by a next one and next two examinations. In the next two is mostly clinical basis on OSCE, objective structural clinical examination. Here OSCE system is
OSCE system is integrated in our medical education curriculum, so one of our assessment methods is an OSCE examination.
Okay. Thank you, sir. It's great to hear. Thank you.
Thank you. And once again, welcome to Georgia.
Thank you,
and
sir.
the Kenwalker International University.
Thank you, sir. It's very grateful to meet Professor Archil, sir.